Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt, your streaming host, and with us, as always, is Dr. Thomas Payne, and we're back for the question of the week. Dr. Payne, this question comes to us via Instagram, and the question is regarding the safety of awake lipo. They want to know the pros and cons. They're curious about it. Dr. Payne, what advice can you give in this situation?
That's a great question. Now, when you talk about liposuction, you've got your different kinds of anesthesia. General anesthesia means you go to sleep, you wake up and you're done. Local anesthesia means you're getting just local alone, just the numbing medicine that's in the lipo wetting bags that we use. And then there's different combinations like local with, say, a few pills to get relaxed, or maybe some medicine in the IV where you're getting deeper relaxed, but not going all the way. Because I tend to do a lot of big lipos, we don't usually use the lower settings. We usually just tell you, go to sleep, no problem. The anesthesia people we work with are great. They do this all the time. It's very safe. But there are cases where you can do limited lipo, and it is safe with a caveat, which I'll come to in a minute. If you're doing smaller areas, say just your arms, maybe just under your chin, maybe a little bit of the belly, some lower part, then the lighter anesthesia is going to be fine for those limited areas. If you've had lipo before, second time lipo, there's going to be scar tissue in there. You can't always tell. The problem with the lower anesthesia, there's two problems. One is that if you're someone that has scar tissue or a problem getting through it, you can't just go to a higher level of anesthesia. You can't sign somebody up for local, give them some pills, and then if it's hard, say, oh, I'm just going to put you to sleep now. Our anesthesia person will do that. You can't do that. You'd have to come back on a different day. So because I do a lot of big lipos, I do some secondaries, I usually tell people, do the general. You're going to be fine. We'll get you through it. No problem. And you won't have any issues. But if you're doing first time limited area, you just come in, you want to do the chin, that's okay to do it under local. You can do that. The big one you got to watch for, and it may not be polite to say, but because this is a competitive field, plastic surgery, and people can sneak into it from other fields, they can be other kind of doctors. They can kind of get around the state rules on who is allowed to do a procedure if they're not doing a general anesthetic. So what that means is someone may hide the fact that they're not really a plastic surgery doctor, they're not really trained in it, or maybe their training was hanging around with somebody for a week or something like that, and then sign you up for lipo and then say, well, I do it awake because it's nice and safe and perfect. That's fine if they're somebody like me or a regular plastic surgeon saying, look, we do it awake because we happen to like that. What they're not telling you is that sometimes they have to stop. That's a fact. But you have to be careful about someone that's not telling you that they're doing it under local because that way they can. That's the part you got to watch for. Now, I'm not saying, you can't say that they're bad results or this or that, but there's a reason why their state might have that rule, and you can get around it by doing local. So what I mean by that is I do local in limited cases when it's necessary, but I never do it because I'm trying to hide anything, if that makes sense. So you just have to do a little second level homework and figure out what the story is. And are you being offered lipo under local for good reason or for maybe a different reason? And you have to think about what you're comfortable with as a patient to make sure you get the best results that you're looking for. So kind of a long answer there, but I think that gets to the heart of it without, getting too over the skis in terms of things I shouldn't say. But I think that gives you a fair assessment of what to look for.
Well, thank you, Dr. Payne. We appreciate your time and look forward to the next question and answer. And welcome back. And we look forward to the next one. We'll see you on that.